Hello, my name is Elias Rosales and today I'll be presenting on syphilis and public health. Number 1. Public health problem. The problem exists in society. Syphilis is a rare but growing disease in the nation. In 2017, 9.5 cases per 100,000 were reported, which translates to roughly 30,644 cases, compared to that of 2000 and 2001, with a national all-time low reporting at 2.1 per 100,000 cases. This disease is a genital ulcerative disease that spans decades if left untreated, developing into three different stages. The primary develops ulcers, the secondary rash, and the tertiary last one results in neurological and cardiovascular disorders. How did this happen? This disease is caused by the Treponema pallidum bacterium that is transmitted by unprotected sexual contact. Where did it happen? This disease occurs all over the nation, affecting all walks of life, but the main amount of cases comes from the westernmost region of the country, which includes California, Utah, and Arizona. Etiological factors. The cases are most predominant with men who have sex with other men, or MSM. Individuals with syphilis are more prone to acquire AIDS or HIV from the open and exposed syphilitic sores, also known as canker sores. African American and Hispanic males are the most infected. Although Hispanic and African Americans are the overall most infected, by the counts of CDC show that men overall are the highest infected. On figure 2 on the right, men account for 7.1 out of 100,000, while women only account for 1.4 out of 100,000. What are the risks for the community in the future? Unprotected sex include touching sore and/or the area of a moist rash. Unprotected sex is touching the rash or the sore, and since these canker sores are not painful, it is hard to detect where they are, and so many people who have syphilis and are sexually active are not always aware. So that is a high contributing factor of why the disease is spreading so fast nowadays. Another factor is having previous cases of STDs. 2. How to solve the public health problem. Strategy 1. Practice safe sex habits. Using a condom or dental dam. Making sure that partner is not infected, and with that partner, practice long-term monogamy with them. Using a condom and dental dam while performing sex is very helpful, yet even though you have a condom, it does not protect the surrounding area, so canker sores could still rub against your skin and infect you. Making sure that your partner is not infected and practicing monogamy could lead to a happy, healthy life. Strategy 2. Education. Educating the public, especially the low-income areas, is very effective to leading to a decrease in cases of syphilis. For example, a public health program that was set into effect was the 2013 syphilis elimination effort that had the goal of providing nationwide info and outreach for syphilis prevention and treatment. How to solve the public health problem continued. Example 1. A cultural example is the Tuskegee syphilis study. In 1923, Public Health Services began an experiment which treated African American males with syphilis, giving them placebo medicine. Even the penicillin cure was out during the 1940s, they were still being given placebos until the study was condemned unethical, and many of the people who were involved in the experiment were on trial. Example 2. Country and historical. Syphilis endemic in Europe. King Charles' invasion of Italy in 1945 led to the massive epidemic spread of syphilis by French soldiers. Mercury as well as other corrosive chemicals were tried to cure the disease, but to no avail. Many people had after effects from the chemicals and even died from them. 3. Public health in the future. What does literature say we should do? First and most importantly, we have to practice safe sex. And this involves us being in alarmed long-term monogamous relationship with an uninfected partner, and with that partner, we should be educated on the disease. On my personal opinion, in my opinion, we should always practice safe sex and even go to the extent of practicing abstinence. Always talk to their healthcare provider and learn ways to prevent and deal with it. Talking to the healthcare provider is a lot better than looking up the disease online, as it's very vague and might stress us out. Thank you very much.